Hello, thank you for having me. For anyone who doesn't know me, I'm Shira Goldsmith. I have my own small swimming company called Goldsmith Swim, and I teach at Yavne High School. I'm going to start off with a little bit of a story explaining how my business has suddenly gotten into fame and why we're using this as an awareness event and helping us learn about the importance of what I do. So we started teaching. Yavne High School has always offered lifeguarding as a class, as an elective. For some reason this year, of all years, they decided to start offering it during school. It used to be on Sundays. The kids had to pay a lot of money. It was a totally separate program. This year, it was my class or yoga. So many girls, even who would have no interest in being in my class, did not want to take yoga. So all of a sudden, we had full enrollment in lifeguarding, even the students who did not know how to swim. And we had to get into the lifeguarding class. You need to be able to swim 300 meters. If anybody knows, that's about 12 laps in a full-size 25-meter pool. So many students want to do it. They come on the first day and are huffing and puffing and drop out after the first one. And many students try a little harder. They get in the first day. And then after the second day or the third day, they say, there's no way I can do this. You can't give me homework. This is gym class. Or why should I have to work so hard? I'm just doing this for fun. So we have this refrain, which we say a lot of times to parents, lifeguarding is not just for fun. It's about life and death. And many times people say, but you can't expect perfection out of a 15-year-old. How can a 15-year-old perform CPR in a life and death situation and save a life? And this is one of these unique situations where lifeguards are only 15 years old. And yes, we expect them to be able to perform perfect CPR and save a life. And so this was the first year. It was an official class as part of school. And then you get the parents who say, well, of course, my daughter has to pass the class. And you need to get an 80% or above on everything to pass the class. So when girls saw right away some of them weren't able to do it, we got some parents who were not so happy with us. They wanted us to make it a little bit easier. They want all different types of things. But of course, their daughters wanted to get that certification at the end. So then on top of everything else, in the middle of our first year of this being part of school, then along comes Beis Yaakov Convention, which happens about once in 10 years in our city, and Cleveland was hosting it. So in a normal high school, you miss class, here and there, something happens. But when it's lifeguarding class and you miss a class, what happens? You need to make it up on your own time. So you can imagine people were even more thrilled with me then when I said, when you miss class, even for something important, you still need to come after school and finish it. The class is about 30 hours, which was spread out throughout a semester. So we're getting closer to crunch time. We still were not done. I said, girls, I think we're going to finish after winter break. And the girls were not so happy. They wanted their certificate before winter break. And they begged and begged. So I decided, for whatever reason, to give in to that. And we came to school every single day before that week before winter break. We practiced. I brought along my own kids as dummies, as victims. One of them is right over here. Because you can't just practice by yourself. You always need someone to save. And we were getting closer and closer to the finish line. And there were still some girls who were not all the way there. And again, I said, you know, nothing will happen if we finish after winter break. Famous last words. Anyways, to make a long story short, we ended up continuing and finishing, and every single girl passed. And there were girls who were at my house at 11 o'clock at night, 2 days before winter break, practicing CPR until they got it. And the advantage of that these girls got was not only were they just regularly learning it in a class, they got one-on-one or one-on-two, because not everyone can come at the same time. High school girls' schedules are notoriously difficult. Try making an out-of-school event and telling everyone it's mandatory to come. It doesn't always work so well. Some of them show up late, some of them have babysitting, some of them have other programs, etc. So it ended up being a little bit of an experiment that took a lot. Anyways, we all finished, we're happy, fine, now I can sleep. 3 days into winter break, I get a call from a student's mother telling me how her daughter fell into a pool. They were vacationing in Florida, and they pulled her out. She was every parent's nightmare, completely unresponsive, blue, not breathing. You can just imagine how scary that was. They weren't even all gathered around the pool. They were barbecuing, they're having lunch, and like nobody was specifically watching this girl till they realized that she somehow slipped off into the pool. Parents froze. They said, what should we do? Oh my gosh, she's blue. You know, they called 911, then they realized, wait, our daughter who just finished lifeguarding knows what to do. They called her from the house. She comes running, performs CPR. for a full 10 minutes. So that's how long it took for EMS to arrive. And Baruch Hashem, thank God that this little girl is okay and actually came to swimming lessons at my swimming practice not so long ago. And what's amazing about this story, first of all, not just that it shows that even a 15-year-old can do it, and yes, you can hold a 15-year-old up to perfection, and in the moment of pressure, they could do it, which is, first of all, very relieving as an instructor to show that they really are capable. But more than that, not just that she was able to do it, she was able, could you imagine being in a room where your child's life depends on your 15-year-old frantic daughter, and you are there as a parent having no clue what to do. And when I spoke to this mother afterwards, what she said, the thing that she learned the most is like, we need to learn CPR. How can you be totally reliant on your daughter? Most people would lose their cool even if they knew what to do. But all the more so to be in a situation where you're there by yourself, every minute counts, and the only one who knows what to do is this 15-year-old girl. And not only did this 15-year-old girl do CPR, but while she was doing CPR, it didn't work right away. And she was doing it after a few minutes, the younger sister vomited, started breathing again for a second, and it stopped. And she was able to do mouth-to-mouth breathing on a mouthful of vomit, continue doing it until her sister was properly breathing by the time EMS came. She still needed to go to the hospital. There was a few nights where things were touch and go, but thank God that she is totally okay. And this was a big learning experience for me, because I said, why do only lifeguards need to learn CPR? Like, I always knew that when I send my kid to a babysitter, I want them to know it. I always knew that learning how to swim is important, but how could it be that so many parents came up to me afterwards and said, oh, I don't know what to do in an emergency, or better, I take care of a class full of 25 kids and I take them swimming every week, and I don't know what to do if somebody would drown. Or like, this kid choked and they didn't know how to breathe, but 911 came fast enough, so we were okay. So at that point I said, if a story like this can happen and we don't learn anything from it, then we're doing something wrong. We have a concept in the Torah of hashgacha pratis, or that everything happens for a reason, divine providence. And I was just thinking about how many things had to happen for this to happen. Here we have a girl who wasn't planning on being a lifeguard, only took it because the alternative was worse. Not only did she take it because it was a class, but she took it the first semester, when if she would have taken it second semester, she would not have been in the right place at the right time. And not only that, but that the class finished 1 week before winter break, when everything was fresh in her mind, and not just fresh in her mind, but so fresh in her mind because she had to try it 10 times to pass the test the first time. So it was so much in her mind that she was able to do it in her sleep, which I can't say that every lifeguard who gets certified a year and a half later, it would be able to do it perfectly. So there was just so many pieces that came together, which exemplifies the idea that you never know when you're going to be called upon to be that person who's in the right place at the right time to save a life. And one of the basic hishtadlus, or something we can do as our efforts to try and do it, is that making sure that everybody should know what to do in an emergency. Anyone know the average response time if you live in Cleveland Heights for EMS to come?
15 minutes.
Somewhere around there, 7 to 10 minutes. And the last time I called 911 and I said my son has COVID and his oxygen levels are in the 60s, and which is pretty low, and he's not breathing well, you know how long it took them to come? 19 minutes. Oh my God. Because our streets weren't shoveled, because this is Cleveland, and the ambulance got stuck. So thank God that I was there and I knew what to do, and everything had a happy ending. But it doesn't always happen like that. So that's kind of the idea of a little bit of what I do. So ever since this event happened, I took that as a little bit of a springboard, and I said, so not everyone needs to know CPR and basic life skills at the same level as a lifeguard, but it's something that you can take a little bit of time, a little bit of education, and everybody could just know something so that in an emergency, they will have some idea of what to do. The chances of a person surviving what we call cardiac arrest, if they do not get care within the first 10 minutes, anyone know what they are? Roughly 10%, yes. So that means 9 out of 10 people, if they don't get immediate care, are not going to be so lucky. as in this story. And so this goes back to verses where if we have immediate CPR, we take care of somebody right away, we can greatly increase their chances of arrival. The point of knowing CPR is not to take over for a doctor, obviously. The point is the doctor is not going to be there in the moment when something happens, is that you have your chance to be there in the moment when you are the only one taking care of someone and something happens. No emergencies are ever going to happen because you're standing there and waiting for it to happen, right? It's only in the books that everything happens when you've got 5 doctors standing around. Typically when an emergency happens, somebody's on their own, you're on the phone, there's 5 things going on, the other kids are making a mess, and the natural reaction is to freeze. So the idea is to learn what to do so that you, or whoever, the collective you, that us, can all be that person that when something happens, we can keep our wits together, quickly call 911, quickly perform that first level of cardiopulmonary resuscitation, and hopefully save a person's life. Obviously, the best is that nobody should ever be in a situation that they should need it, but this is what a basic measure that every adult and every caregiver, every babysitter should have some knowledge of what to do in an emergency. Anyone know one of the most common causes of death in children ages 1 through 4? Choking is close, but drowning. Not cancer, not car accidents, not taking too much medicine, drowning. And it's very, very common that young kids don't know how to swim. And how long does it take for somebody to drown and stop breathing? Less than 2 minutes, typically. And sometimes it's noisy. Sometimes it's the classic help, help, and I'm flailing, and then they fall down, and then they go down. And sometimes there's what we call silent drowning, where a kid just wanders off into the pool, they don't know how to float, and they just go down without a struggle. I've seen it so many times at my own swimming lessons, that there are kids that they won't have that natural reaction to start moving around, and they let go of whatever's holding on, and they just fall down. There's another story when I was 15 years old, my first lifeguarding job, of course. Back in the day, they used to not have all the safety protocols that we had now. I was lifeguarding by myself. We did not have cell phones in that day. Now, the legal requirements are that when you lifeguard, it's supposed to be 1 lifeguard to 25. Then that was not enforced. There was about 75 kids in the pool. I was there by myself, 15-year-old. Who am I going to be to stand up to the JCC and say, you're letting too many members in? Obviously, I didn't do that, although maybe I should have. The kids are all crowded around the steps in the shallow end. What happened? Somebody pushed a kid under. She didn't have a floaty, nothing. No struggle. She went right under. I did not see her right away because there's about 50 kids on this little shallow area. I kept scanning the pool. I was a new lifeguard. I remembered everything my instructor told me. After she was probably there for about a minute or 2, I saw her and froze. I quickly thought, oh no, I have to get it. There's no one here. I ran. I didn't remember to blow my whistle. I didn't remember to scream everyone out of the pool. I just ran into the pool, pulled her out. To my horror, she was not breathing. I pulled her out. I screamed to one of the adults who was lap swimming. I blew my whistle. I said, call for help. She says, I'm in my bathing suit. I need to finish my laps.
Oh my God.
So I ignored her and just started performing CPR. After about a minute and a half, the girl started throwing up, breathing again. And by the time 911 came, a full 30 minutes later, which the joke in Atlanta is that you can get help by calling for a pizza faster than you can get an ambulance, because unfortunately the response times there are notoriously horrible. Full 30 minutes for them to come when they were called that somebody was found unresponsive in the bottom of a pool. I was there by myself. Imagine the crowd control. 50 kids, about 5 ladies lap swimming, 50 to 60, 70 kids there, a few ladies lap swimming, and little old me. I was performing CPR. All the kids are gathering around. At this point, the mother realized what was going on. We had crying adults, crying kids, everybody yelling, full pandemonium, everybody's nightmare. I sent someone to go to the lifeguard. I was still attending to the girl. I sent someone to go to the room where the lifeguarding phone is, and guess what? It was out of service. They ran out, got their cell phone. By the time that would happen, that was also part of the delay. And I always just say a million times that I thank God that I knew what to do, that I kept my cool, that this girl was okay. And she still comes to visit me sometimes and brings me stuff before the holidays because we still keep up. Because saving a life is something that you're never gonna forget. It's one of those experiences that is life-changing. And we never want it to happen. We never know when it's going to happen. But that's the type of, and you might forget everything. And I always say this when I teach a class, and I'm going to in a few minutes give a little bit of a short demo, just a little bit of an introduction, what you should do. But if you might not remember anything, but if you can just remember one or two basic things, then you too can be that person who will be in the right place in the right time and remember what to do. The whole idea of hands-only CPR the whole concept came out not so long ago. Anyone remember something called COVID? People were afraid of putting their mouths on somebody else's mouths. And around the same time, people were trying it, different things. And then the AHA said, hey, we can start telling everyone do hands-only CPR. It's going to take a third of the time to learn. And people are much more likely to do that. They found that a lot of people, AHA is American Heart Association, they found a lot of people are more likely to do CPR if they do not actually need to put their mouth on top of somebody's mouth, which is what we teach it to bystanders, which is people who are not medically trained. And it's something that's very simple and easy to remember. In an emergency, you're not going to sit there and think, oh, I have to compress 2 to 2.4 inches. Oh, let me take out my ruler. Quick. Okay, how far down does the chest go? And you're not going to sit there with your timer. Can I do 100 beats per minute? And you might remember the song Staying Alive. You might have some other song in your head. But the numbers are not going to be straight at the top of your head unless you're a doctor. So the idea of teaching just the basics is that something that's easy to remember. We don't want to confuse people. We want everyone to just know very simple, if this happens, this is what we do. Anyone know when we do CPR? What are we looking for? To see if somebody's what? Not responsive, right? So there's if they can breathe, right? Then we want to know if their heart and lungs are working. So the easy way that we like to remember it is look, listen, and feel to know if somebody's responsive. When you look at a person, and many of us have children, right? When we look at a child when they're sleeping, what do we always see happening to their chest? Their chest is going up and down. It might be slight. Some of us might snore. It might be more, but you're always going to see some form of movement. What are we going to hear if we would put our ear to someone's mouth and nose? You're going to hear some form of breath, right? Feeling a pulse is a little bit harder. A lot of times people have a hard time finding a pulse, and that's okay. That's why we do all three things. If somebody falls down in front of us, first thing we are going to do is check if they're responsive. We're going to hit them over the shoulders and say, hey, are you okay? Right? Maybe they just fainted. Let's say somebody fainted. They still might need help, but it's not a medical emergency at the same level as if their heart and lungs stopped working. And if you work in a high school or a college campus, you might notice kids sometimes think it's funny to go to sleep in the middle of the floor. So the first time when I walked into the high school and I saw a girl lying in the floor, I immediately went into crisis mode. I start shaking her and I say, hey, are you okay? And she looks at me and she says, why did you wake me up? So that's the first thing we want to do, is we want to know that the person is okay. So first thing, we're just going to shake them a little bit. If you know their name, even better, and see if they respond. Now, even if somebody's sleeping, when you shake them and call their name, hopefully you're going to get some sort of reaction. Maybe they're going to move around a little bit. Maybe their eyes will move, something. So that's our first level, is just check with them. Now, normally before we would provide care, we would ask what we call consent, right? We would say, can I help you? But obviously, if somebody's unconscious, we're not asking permission. It's what we call presumed consent. And there's something called the Good Samaritan laws, which means that this person cannot go and sue you because you tried to help them save their life. Going back to the statistics that we talked about before, somebody who's in cardiac arrest has a 90% chance of not making it if we wait till 911 comes. So do we have very much to lose? No. We might cause them to break a rib. We might give them whatever cold or virus we have. We might make them uncomfortable. But there is nothing that outweighs saving a life. The Torah even tells us that saving a life, we're allowed to break Shabbos, which is considered one of the one of the big ones that we use if somebody is following the Torah, is we see, do they keep Shabbos? If there's a life and death emergency on Shabbos, is anyone going to hesitate before calling 911? No. Nor should you, right? So that gives us a little bit of idea. Even Yom Kippur, which is the holiest day of the year, if doctors are allowed to work on Yom Kippur, doctors are allowed to work on Shabbos, right? When somebody is saving a life, I don't want to say everything goes out the window, but you don't need to worry about anything. You don't need to worry if it's awkward. It doesn't matter if it's your kid's teacher or principal or whatever. Whoever it is, the only thing they're going to say afterwards is thank you. We hope. You might be unlucky and get that one or two crazy person who will say, why did you do that to me? But most people will be happy. The Torah values saving a life very, very much. And they say that somebody who saves one life, it's like they saved the whole world. Right? Going back to the little girl who I saved 20 years ago. Right now she has 4 kids. So if, God forbid, she would not have made it, her 4 kids would not be here in this world, right? And that's just a simple example. Many times coming out of one person, there might be 100 people, right? You go back 3, 4 generations, one person is like a whole life, is like a whole world. And we're looking at it that if you save a person's world, you can pull out everything. It doesn't matter what you're doing. This is the most important biblical commandment that you can ever do, is to save this person. So nothing matters. It doesn't matter where you are. It doesn't matter who's watching. It doesn't matter what's around. This is the moment where you have your choice. Are you going to choose life? Or are you going to be too scared, too uncomfortable? Maybe it's someone of the opposite gender and you're not comfortable touching a man or a woman or vice versa. You need to decide, is there anything more important that I can do than doing this? And hopefully we will all make the right choice, which would be to try and save this person's life. So going back, first thing we're doing, we're checking with the person, are you okay? Then they don't respond. Next thing we're going to do, look, listen, feel. Do we see movement in their chest? Do we hear anything? Do we feel a pulse? If we cannot find a pulse or see any movement or hear anything, how long do you think we should take? Should we take 5 minutes to check? Maybe there's a pulse. I don't know. Let me try over here. Let me try here. No. We're going to take, anyone know? 10 seconds. Thank you. We want to take about 5 to 10 seconds to check if this person is okay. If you don't see any signs of life, you're going to go straight into our compressions, which is the first step of CPR. Now, if the person is awake and okay, and you start pushing down hard and fast in the middle of their chest, I can guarantee you they will push you away. Even if they're sleeping, even if they're faint. You have very little to worry about, that this person is totally fine and they don't need it. Because it's not something you can ignore. When somebody's doing CPR, you're pushing hard. They're not just going to sleep through it and then wake up with a few broken ribs. So this is a situation where you've got nothing to lose. Sometimes it's very obvious why a person needs it, right? Sometimes a person was drowning in a pool, someone pulled them out. Sometimes someone was choking and then they stopped breathing. Sometimes something happened like that. Many times it's not going to be that obvious, right? It happens very common, especially with babies, that someone tries to wake up the baby and the baby doesn't respond. So this is the type of situation you might not see what happened. You might not know what happened. There might not be any obvious signs. So that's why we're going to first start with checking, and then we're going to move on. I'm going to bring out my little pops. Okay. Okay. So just for the sake of this demonstration, I'm just going to show you on a mannequin, and anyone who wants to come and give it a try afterwards is welcome to. So here's our little friend. So when we look at a person, we're going to find the center of their chest. And we're going to find the center of their chest, and we're going to push down hard and fast. We want to be doing it at a rate of about 2 compressions per second. We like to say it's 100 to 120 compressions per minute. Now, going back to what I said before, you don't need to remember the numbers. You just need to remember, I'm pushing hard and fast. It might be too fast. It might be too slow. We've got nothing to lose. We just want to push as hard and as fast as we can. Now, if you're comfortable and you want to do the breathing also, then we would go with a ratio of 30 compressions, 2 breaths, and keep going back and forth. But for most people who are not taking a full CPR class, which I would recommend for anyone, and I do offer them, if anyone wants, you're welcome to contact me separately. But if you're not taking the full class, you just want to remember, we're going to push hard and fast right in the center of the person's chest. A real person's chest doesn't light up to tell you if you're doing it right. The mannequins are a little bit helpful like that. So a lot of people have questions. How would I know where it is? How would I feel it? I feel bone when I feel the center of my chest. I feel my ribs, right? And you might feel a person's ribs with a real person. And you might also break a rib. And that's okay, right? We don't care because a broken rib can heal. A heart that stops cannot heal. And every extra minute that a heart is not working can cause permanent brain damage or other issues. So every second is really important, and we're not going to waste time. Can I be careful? Should I push a little lighter? Anything like that. We are just going to push hard and fast in the middle of the person's chest. And many buildings have something called an AED. Anyone knows what that is? Okay, what is it?
Automatic electrical defibrillator.
External defibrillator, good. So an automated external defibrillator is meant that a layperson should know how to use it. Sometimes it will be in a little case that says American Red Cross. More frequently, you're going to see it in a glass box. Many stores, shows, and other places have it. And next to the little glass box, there's typically a hammer that says break open an emergency. That's because these things cost a good few $1,000s, and there's a huge black market for it. In an emergency, you are not going to, don't worry about being polite. It might make a siren go off. You're going to send, if somebody else is doing CPR, the first thing somebody should do, if you're in a building which has an AED, and again, most schools, shows, organizations are supposed to have it, you're going to find it. What's really cool about an AED is that it's meant that anyone should be able to use it. The AED talks to you. So in real life, you don't have a person saying, push harder, do this. If you forget to put the pads on the person's chest, the AED will tell you that you didn't do it. So if you turn it on, it will talk to you. It's going to tell you exactly what to do, which is what's so great about them, because you have very little to lose. Let's say I turn it on. And I don't, let's say I turn it on and
This is a training device only.
And I don't apply the pads. So listen carefully, it's going to tell me that I didn't do anything.
Attach pads firmly to person's bare chest as shown.
So I'm just sitting here, I apply the pads, and I forgot to plug them in. After about 10 seconds, it's going to start flashing a light, and it's going to tell me plug in connector. If you look over here, the light is flashing. And it's going to keep talking to me until I do it right, which is what is pretty amazing about these. Okay, then when it's analyzing, I'm going to stand back, right? We don't want to get a shock. We don't want the AED to see my heart rate. Okay, so it's analyzing, I'm standing back.
Shock advised.
And then it tells me, right? Again, we've got our little flashing button. It's going to say, push the button. Oh, I forgot to push it. It tells me again. You have very little.
Shock delivered.
These are meant that any person can use an AED, and the AED together with CPR give a person a very high chances of being okay if done promptly after a person goes into cardiac arrest. One of the amazing parts of technology is that AEDs are now found pretty much everywhere, which is great because, as we were saying before, 911 does not always come as soon as we would like it. So this is our little machine that can help our person start breathing faster. Now what about with our little baby? How is a baby different than an adult? Anyone know where we do compressions with the baby? How do we do it?
With our 2 fingers.
Okay, good. We're going to use 2 or 3. Yes, that's my daughter. So even before we go into anything with the baby, where's the most responsive spot on a baby? On their foot, right? We're going to kind of tickle his toes but not be so gentle. Hey baby, are you okay? Right? And then the same thing with our baby. We're going to do our same thing, look, listen, feel, right? Do we see any signs of life? Which again, is his chest moving? Do we hear any breaths? Do we feel a pulse? We're gonna look, listen, feel for roughly 10 seconds. Okay, 5 to 10 seconds, and then we are gonna go straight. We wanna be on a flat, firm surface. This is very important, especially with a baby, because typically, where is the baby gonna be sleeping on? A crib, something soft. We do not wanna do CPR on a soft mattress. We wanna move them onto the floor or somewhere where you're gonna push, because right, if you're going somewhere and it's soft, you're going to end up pushing them down with everything. I get asked this question all the time by beginners in my lifeguarding class. Can I do CPR while someone's on a backboard? Now think for a minute, if you've got someone, oh yes.
Can I ask a question?
Sure.
It's for CPR, it's 5 pushes and then a breathe.
So you're probably thinking of what we used to call the Heimlich, and now we just call abdominal thrust and back blows. That's the 5 pushes up here. But CPR is the typical.
She's talking about a million years ago when I was doing CPR.
It used to be 5?
Before, it was 5 to 1, and then it turned to 15 to 2.
Okay, 15 to 2 I remember, but 5 to 1 I don't remember.
Well, I don't
So it's like I have audio processing issues and I can't hear correctly, but it sounds like you were doing 5.
Oh, I just did 5 because I wanted to demonstrate. We would actually do 30 to 2. 30 compressions, 2 breaths, but you don't even have to remember that right now.
You say 30 compressions, 2 breaths?
Yes. Yeah. Yes, but again, if you don't remember the numbers, we just want you to remember, push hard and fast in the middle of the person's chest. And research has shown that just compressions are better than nothing. Okay, so if all you do is just sit here and just push, you can do this you can do this for 200 times. Just keep going.
Up to 30.
You can do more than 30 even. You can do more than 30.
You can do more than 30 and
Yes.
then the 2
Right.
breaths.
Yes. And if we are doing the 2 breaths, something important is to make sure that we tilt our person's head back and we're going to pinch his nose and get a good seal. I'm not going to show with the breaths right now just because this is more of a general class. But yes, it would be 30 to 2 or you're just doing compressions, just pushing. So,
I'm not sure why I thought it was 5, and except, well, yeah, anyway. It's
that's okay.
important.
Yeah, so that's okay. So right now we just want to remember, push hard and fast in the middle of the person's chest. And if anybody watched the video where this girl who recently did CPR spoke, and they asked her, did you remember the numbers? Were you being exact? Did you make sure to do 30 to 2? Were you measuring? Anyone know what she said? I didn't remember at all. I was just moving and compressions and breaths, compressions and breaths. She vomited, I pulled her to the side, got it out, and did it again.
Do you advise that we take a course at the Y?
It's a great idea. Yes, I strongly recommend that everyone take a course. I think it's a great idea. It's something that the more people who learn it, the better. And really they recommend that everyone should take it every 2 years so that it's fresh in your mind. And also science changes. Sometimes they say one thing, the numbers have changed quite a few times, but it's always helpful to take a class.
Do you ever get concerned? Don't you see, the thing that would be concerning, do you ever get concerned about like bones or anything?
No, because do we have anything to fear when this person is clinically considered dead? Right? If you do nothing, this person has 0 chances of making it if 911 takes more than 10 minutes to come. Even if you break a broken bone can heal. A broken rib could heal. It doesn't matter, right? If a doctor would come and see a person, right, it's considered like they're clinically dead and you're resuscitating them. You're reviving them. So this goes back to what I was saying in the beginning. We've got nothing to lose. Nothing matters. Right? You can push too hard, it doesn't matter.
Right.
There's really very little to lose. And even if you do push too hard, we would rather an alive person healing in the hospital with a few broken bones than a person who does not make it. Okay. Can I get a volunteer? Bossy, want to come up? Just happens to be my sister. Okay. So when somebody chokes, we used to call this the Heimlich. We don't call this the Heimlich anymore because of various political reasons. There's a lot of dispute between American Red Cross and Dr. Heimlich as to whether this should be called, as whether choking care should constitute abdominal thrusts and back blows. So the famous name that everyone calls it is Heimlich. In medical literature, you might not see that anymore. So this is our little vest is going to help me. So if somebody is choking, because obviously you never want to practice this on a real person, you might make them throw up. It might be uncomfortable, but you want to know where to find the spot. If somebody's choking, can anyone show me what the universal sign for choking is? Yes, typically somebody will be clutching their throat. right? Now, if somebody's clutching their throat and coughing, that's a good thing. We like it if someone's coughing. That means they're trying to breathe on their own, right? So somebody's coughing and clutching their throat, we're going to encourage them. Keep on coughing, right? Their body is trying to get it out on their own. Now, let's say they stop coughing. That's when we're going to step in. And obviously, if we see somebody who's choking, we're not just going to be like, oh, they're coughing, they're okay, go run off. I'm going to stay there and watch, because maybe she won't be able to get it out on her own. So she was eating her little carrot, right, and it got stuck. She can't get it out. A person stops coughing, and they start going a little bit blue, right? Their color starts changing. They can't get out any audible sounds. So in this case, the person is not completely unresponsive. So you can actually ask them, are you choking? Can I help you? Typically, they'll be able to nod, tell you that you can help them. So we're going to go around our victim. We're going to find their abdomen, their belly button, and we're going to make a fist. We're going to push hard and fast 5 times. Okay, and our carrot's still there, so I'm going to lean her forward and give her 5 back blows. The one disadvantage of the vest is that if it doesn't fit perfectly, it doesn't always come out as easily as it should. There we go. So now we got it out. Thank you. Okay, so this is what you would do on a real person. Thanks. Okay, you can take it off.
So this is a 5 count.
This is where we do 5 and 5. So we're going to do 5 abdominal thrusts, 5 back blows, until either the person coughs it out or throws up, or, God forbid, the person becomes unresponsive, in which case we would gently lower them to the ground and start taking care of them. So a few important things about when somebody is choking. Okay, so first of all, when you're giving someone back blows and they're barely breathing, and I start pushing hard and fast, what do you think is going to happen to a person if I'm not supporting them? They're going to fall over, right? So you want to make sure to put your hand around them before you start hitting them really hard. That's one thing. The other thing is, so how do we find the space? And what happens if it's a person who's a little bit too big? I can't reach around them. All different things. What? I think I heard someone say it. No. Okay. If a person is by themselves, yes, a person can come over to a chair and or a table and try and use it to help them push it out. That is true, right? But if you're around another person, and let's say you're like me and you're 5'1", and you can't reach around, the volunteer is 6 feet tall. So there are times when a person is going to have to push on the chest instead of pushing on the stomach. When we're able to, we're going to look around for the belly button and then push in and up. When we're not able to, we sometimes need to be a little bit more creative. This is where we remember our counts of 5 and 5. 5 abdominal thrusts, 5 back blows. Once the person starts coughing, great. That's what we want. That is the basics. With a baby, we're going to do it a little bit differently. With a baby, and babies are very likely to choke, we're going to go back and do almost what we do with our chest compressions. We're going to push 5 times. Right, with our 2 thumbs, and then we're going to hold them, support them, and do our 5 back blows. When a baby starts throwing up, we do not want them on their stomach. Really, when anyone starts throwing up, we don't want them on their stomach. If someone's on their stomach and they start throwing up, what's going to happen? They're going to choke on it or swallow it. What?
You mean on their back?
Right, we don't want them on their back, right? We want them on their stomach or on their side in what we call a recovery position, so that the person can easily get whatever is inside on. And anytime when someone is doing CPR or any type of medical care on a person and they start throwing up, if they're not able to get it out on their own, you're going to want to help them turn and get it out, whatever they have. Any questions on any of this material?
Could you show the baby one more time?
Sure. The CPR or the choking?
The choking.
Yeah.
Holding the baby in the
So, well, normally I wouldn't be holding. I would likely be sitting down, right? We're going to have the baby on my lap. I'm just doing this so you can see, right? I want to support his head, and we're going to do, right, we're pushing 5 times with our 2 thumbs, and then we're doing the 5 back blows.
sitting on your lap.
Meaning whatever position, it also depends on the age of the baby. if a baby is, the big question is what defines a baby? By the time you're not able to hold them like this, they're already considered a child. Once it's 2, 3-year-old, that's when we're going to go more as a child than as a baby. But yeah, so whatever position you can be in, that you're able to have them head supported and be able to compress against the chest in a way that's going to be easy for them to get out whatever they need, and then easily flip them around from front to back is fine. Yes?
So you discussed swipe. My son
Yes.
actually say this swipe, but I know it's not so recommended.
Yes, okay. So you never want to do a blind finger swipe. That means if somebody's giving CPR and you give a breath, normally when you give a breath on someone, you're going to see their chest rise. Now sometimes you give a breath and the chest does not rise. Many times it's because you didn't give the breath properly. Sometimes it's because the person was choking and something is blocking them from the breath going in. So you're going to take a look. If you see something that's towards the top of the mouth that you're easily able to get with your finger, then you would stick your finger in and take it out. But we never do what we call a blind finger swipe. If we don't see it coming, if we don't see it easily on the top, we don't want to stick our hand too far and make it go down further. So if we don't see it, it's not clearly visible at the top, we're going to go back to our compressions, or if it's a case of choking, abdominal thrust and back blows, that's going to help it come out. So the swipe is only if you see something, then you would stick your finger in and take it out. Good question. Yes?
Would it hurt a baby to be on a hard surface?
It might hurt the baby, but breathing is even more important than hurting them. And it might hurt the person also. That's a good question. We don't care if we hurt them because we want them to be okay. And when somebody is, God forbid, unconscious or something like this, they don't feel any pain. So it's not hurting them. Yes?
When do you stop?
When do you stop? Great question. One of 3 things happens. Either 911 or the AED arrives, in which case you would stop CPR and immediately begin putting the AED pads on, or if 911 comes, you would give over the care to the person, to the EMTs, or you see a sign of life. Meaning, if the person starts coughing, gagging, something, you're going to try and move them to their side, help them get it out. Roughly every 2 minutes while we're doing CPR, we're going to recheck the person's vitals. Again, going back to the look, listen, and feel, and see if they're alive. Hopefully you did. Sometimes when a person comes back to life after something like this, their pulse might be very weak. You might not notice it right away. In many cases, when the victim was choking or drowned or something like that, why did they stop breathing? Because there's so much water or whatever else in their lungs. So hopefully the response that you're going to see is them throwing it up. But in some cases, it's not so obvious. And that's why just every 2 minutes, you're going to recheck. Take those 10 seconds, see, do you see his chest start rising on his own? Do you hear breaths? And otherwise, you're going to keep going. As a lay person, we are never allowed to say, oh, a person is dead. We keep going and keep trying until doctors come and then let them try everything. Sometimes they can do CPR for 30 minutes and then a person will start breathing again. We never know. It's exhausting, right? CPR, if anyone who has ever done it will know it's not something that is easy, especially if you're out of shape and don't normally do any major exercise. But you hopefully will get some type of strength from the emergency that when you know somebody's life is in your hands and you're not going to feel the exhaustion until afterwards. Typically, after something like this happens, then it hits you. Yes?
Where did you get your training?
It's a good question. So both from American Red Cross and American Heart Association.
The American Red Cross?
Yes, and American Heart Association.
And the American Heart Association.
Yes. When I teach CPR just to general people, I typically teach through American Heart Association. When I teach it to lifeguards, I typically teach through American Red Cross. Yes?
Why the difference? What's different about the 2 certifications?
Great question. They're very similar. There's a few small differences. I personally find that American Heart Association is more user-friendly for someone without any medical knowledge, unless you're doing the basic life support where it's meant for medical professionals. American Heart Association, I find, uses a little bit simpler information, a little less terminology. I just find it easier to give over. Their certification cards are also a lot cheaper. When I give American Red Cross certification, I pay about $30 for each person I issue a card to. AHA is about $20 or less if if it's a student. So that's really the main difference, is practicality. But any CPR class is good. It does not matter which one you do. Each one has their little things. But as you see, you can do CPR with 30 to 2, and you can check every this amount of time or this amount of time. The details are not exactly as important as making sure you're pushing hard and fast in the middle of the person's chest. Any other questions? So just to wrap up, if we get anything from my little talk tonight, is first of all, you never know what strength you have inside you. You never know when you can be that person who's going to be in the position where someone's life depends on you. And because you never know, you want to have this amazing merit, and we can't even imagine how great the merit is of being that person who's there at the right place. A famous Red Cross quote is, "Don't let tragedy be your teacher." And unfortunately, as a lifeguard instructor, I've mentored students who have had a fatality happen on their watch. And it's not something that somebody can ever get over. And I've been in touch with parents whose kids drowned, who have gotten involved in the aquatics field. So we can take a situation where, God forbid, something like that happens, and yes, we could learn from that. But then we learn with a lot of tears, a lot of agony, a lot of very sensitive feelings. So what I took out of this event was that we don't need to wait for something tragic to happen. This was my wake-up call. Hearing that somebody who learned and took the class was able to do it kind of pushed me that maybe I'm not going to have time. I'm not going to train in the whole Cleveland. But even if I train in 200 people every year, and all it is one student out of every 200 will use something, then that in itself is huge and can't be measured. Yes?
I'm so thrilled that you did what you did, and was so proud to see it. You know, taught so many children how to save people's lives. The only thing that I thought was missing from the article, great article, was the fact they weren't talking about little kids learning how to swim.
Yes.
That was the only thing that was missing from that.
That is true. And if you look at the Red Cross blog, they actually, on Red Cross, they posted mostly about May is Water Safety Month. Kids need to learn how to swim. Drowning is the leading cause of death. And here's a little excerpt of something that happened. When the media interviews, they're looking at, this is a sensational story. A teenager was able to keep her wits about her and do something in an emergency. And they like the little twist that this class just happened. As a believing Jew, I like to believe that nothing just happens. I want to believe that all of these things came together. And anyone who's ever taught teenagers knows that typically tears, even younger kids, tears don't move me. Because kids probably cry on average once a week or more when something little goes wrong. And a kid might cry just as much because something small goes wrong as they will when they hurt themselves and have a broken bone. You cannot tell the difference in, I have a bleeding boo-boo on my finger, and oh my gosh, I fell down and everything hurts and I can't stand up. So sometimes, I want to think that there was a reason that this kid cried that we weren't finishing the class. And there was a reason that those tears decided to move me this time. And yes, this girl was one of the girls who really wanted to finish. And at first I was just like, she's just a crier. Some kids are like that. And then I was like, no, the pressure is coming on all ends. These kids want to do it. They worked hard. I can push myself a little bit. And I pushed myself, and after the first little bit, the girls were still not ready. And I was like, so do I stop now? And the girl said, no, we'll come to your house. We'll babysit for you. We'll cook Shabbos, whatever it takes. We need to finish. So then I said, okay, you're speaking my language. So come to my house after my kids are asleep at 9 o'clock, and we will practice, and we will get you there. And as my kids can attest, many times students come to my house. Sometimes it's 9 o'clock, sometimes it's 10 o'clock, sometimes it's 12 o'clock. But when somebody really wants it and really has that desire to do it intrinsically, they just want that satisfaction, I just feel like, who am I to stand in their way and say no? And not that I never will say no, but just, yes, the water safety piece cannot be impacted, cannot be understated. And also the fact that every single person has a responsibility on yourself, that if you're in a situation where you're taking care of other people, or you're responsible for young kids, or you're watching your grandchildren at the pool, you should know what to do if, God forbid, something goes wrong. And I give us all a blessing that nothing should ever go wrong. We should never need to know anything of what I spoke. And I hope I should never need to know it, but just in case, you never know. And I hope that if you do need to know, you'll know what to do, and then call me afterwards and tell me that you did it.